Thank you so much for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con supervisora Hopkins.
Thank you so much, Gilbert. I'm Lynda Hopkins, supervisor for Sonoma County's 5th District and current chair of the Board of Supervisors. Welcome to our COVID-19 and vaccination community briefing for Wednesday, May 5th, and happy Cinco de Mayo. I'm pleased to say that we have reached some important milestones here in Sonoma County in terms of our efforts to get locals vaccinated. First, we have now passed not only the 200,000 mark in terms of the total number of people fully vaccinated, but also the 50% mark for our population in terms of the eligible population. This is very, very exciting news here in Sonoma County. We can also now announce that more than 2/3 of our eligible population, more than 67%, have received at least one dose of a COVID-19 vaccine. This is significant because just yesterday, President Joe Biden said in a speech from the White House that it was his goal that 70% of all eligible Americans would have at least one dose of the COVID vaccine by July 4th. Here in Sonoma County, we are nearly at that goal already, with nearly 2 months to go. I really want to take a moment to acknowledge all of the hard work of our dedicated medical professionals and community leaders, as well as our county staff in leading the charge to get to this point. Most of all, I also want to thank our residents for their patience, resilience, and their commitment to helping our community to reopen and to protecting the health of their families, friends, and neighbors by getting vaccinated. These vaccines are safe, they are effective, and they are free. And we know that they have proven to be the best tool that we have available to help us all get back to normal as soon as we possibly can. So we really strongly encourage everyone to say yes to getting their vaccinations. We are also on the cusp of possibly moving into the least restrictive yellow tier, which would mean opening up more of our local economy. We'll be talking a little bit more about that during our program tonight. Meanwhile, in 6 weeks, assuming our continued progress, the state plans to do away with the tiers and the blueprint for a safer economy altogether. So we want to talk a little bit more tonight about what that looks like for our community and for our local businesses in particular. To help us get a better understanding of what our new normal will look like for our business community, we'll be talking with Sheba Person-Whitley, Executive Director of the Sonoma County Economic Development Board, and Peter Rumble, CEO of the Santa Rosa Metro Chamber of Commerce. We'll also be talking to Ken Tassif, our Vaccine Mission Manager, about the next phase of our vaccination campaign, including a new mobile clinic that will be starting next week to target our hard-to-reach populations right here in Sonoma County. But first, I would like to turn it over to my colleague, Supervisor David Rabbitt, who will be talking about the governor's Beyond the Blueprint reopening plan. So, mute, Supervisor.
It's only been about 1 year and 2 months. Thank you, Supervisor Hopkins, Chair Hopkins. As we all know, Governor Newsom has stated that June 15th is the date that the state intends to do away with the blueprint tier system and reopen most of the economy, no matter what tier we are in at the time. That's predicated, however, on 2 things happening. One is that there's enough vaccine supply for all eligible Californians and that hospitalization rates remain stable and low, especially among fully vaccinated Californians. Assuming those 2 criteria are met, all business sectors will be allowed to return to normal pre-COVID operation, although common sense health measures like mask wearing will still be required. In addition, schools will be directed to conduct full-time in-person instruction. That means a return to the classroom for all of Sonoma County students in the fall. Testing and vaccinations may still be required for some sectors, including large-scale events. Right now, it's relatively easy to find a vaccination appointment in Sonoma County. We've reached that inflection point where our supply is now greater than the demand. Same-day appointments at many of our vaccination clinics are available at myterm.ca.gov, which is really the most comprehensive site to find an appointment anywhere within the county. Many clinics are even accepting walk-in patients, so now is the time to get the shot and protect yourself and your family and the dog and the community itself. June 15th is just 40 days away, right around the corner, and we can look forward to a return of a more normal way of life. In the meantime, we need to adhere to the orange tier restrictions before we move on to that yellow tier and open more of our economy. For more on the tier status and when we can anticipate moving into that yellow tier, I'm going to turn it over now to our health officer, Dr. Sandori Mase. Dr. Mase?
Yeah, thank you so much, Supervisor Rabbitt, and thank you to Chair Hopkins and everybody else who is participating today and listening in. As Chair Hopkins noted, we are on the verge of moving into the yellow tier. As of yesterday, we had our first week where all of our key metrics qualified Sonoma County for the yellow tier. If we can maintain these numbers for another week, we will be able to move into the yellow tier next week, by next Wednesday or Tuesday, that is evening Wednesday at 12:01 a.m. Our metrics are continuing to drop, so that is encouraging news. As of today, our adjusted cases per day per 100,000 is 1.9, which is below the 2 needed to qualify us for the yellow tier. Our overall testing positivity at 0.9% is within the yellow tier. Meanwhile, our testing positivity in the lowest quartile of the Healthy Places Index is 1.2%, which is also in the yellow tier. So everything is at an all-time low at this time. Once we are in the yellow tier, it will indicate that the virus is only minimally spreading in our community, and it will signal that an end to the pandemic is in sight. Until then, we just need to continue wearing those face coverings, getting tested, and practicing social distancing. I want to really underline the need for people to still get tested. You should get tested if you have any symptoms that you're concerned about, or if you think you've been exposed to someone who has the virus. Testing still helps us identify and isolate cases. It also helps us to move through the tiers and get closer to the end of the pandemic, a time that I know that we are all looking forward to. I also just want to note that we are right on the cusp between orange and yellow tiers. So even a little bit of help from the community in terms of continuing all the mitigation measures, not gathering with people, especially if you're not vaccinated, and getting tested. These are the things that you can do to keep us in the yellow tier metrics for this next week so that we can move into the yellow tier. So now I'm going to turn it over to Dr. Shende, our vaccine chief, to share an update on the vaccination campaign.
Thank you, Dr. Mase. Our vaccine supply still remains flat, but meanwhile, demand has significantly tapered off now that nearly 70% of our eligible population has received at least one dose. Thanks to our vast constellation of vaccine clinics and providers, we've made great progress in getting people vaccinated. As of today, Sonoma County has administered 467,642 doses. That means that 2/3 of our residents have had at least one shot, and 50% of residents are fully vaccinated. And the credit for this, I have to say, goes to all of those health clinics out there, our hospital partners, all of the primary care providers, all the clinics that have made this possible. We have a number of state supported nurses who have come into our county to make this possible as well. So we have much gratitude for all the hard work that's been done to get us to this point that has made our community much, much healthier. Just a few weeks ago, vaccine appointments were hard to come by, and now they're plentiful. And anyone who wants one can get an appointment at one of our many clinics, pharmacies, or health centers. Some are even accepting walk-in patients. Just go to myturn.ca.gov to find an appointment that works for you. You can always go to our sonomacounty.org/vaccine webpage as well to find many, many different clinics and be able to either sign up or, as mentioned earlier, many of them will accept walk-ins. We understand that many people may not even realize that after so many months of waiting, that now everybody who's over the age of 16 is eligible. So there's no need to wait any longer, and it's best to just go ahead and get vaccinated to protect yourself and those around you. We're still not at herd immunity, so we'll continue to reach out to offer vaccines to hesitant individuals and those and hard to reach populations, as well as those who just have a hard time getting to the clinics. We are continuing to reach the harder to reach populations such as homebound seniors and the unhoused population through mobile clinics. We are preparing for the FDA to approve emergency use authorization of the Pfizer vaccine for children aged 12 to 15. That will most likely come within the next week. At that point, we will activate our network to get those children vaccinated before this next school year. We're also collaborating with Sonoma County Office of Education and Safeway to provide vaccine clinics for our 16 to 17-year-olds. This will begin this Saturday, May 8th at Elsie Allen High School from 2 to 6 p.m. and next Wednesday, April 12th at Sonoma Valley High School from 3 to 7 p.m. Links are available for signups and messages have been sent through the schools, but walk-ins are also welcome. So it is open not only to students, but also to their families. So if there's anyone in the household or any extended family member who has not yet received a vaccine, they can come in at the same time to get vaccinated. We'll continue with additional clinics moving forward for the schools into May and allow for the 12 to 15-year-old age group to also get vaccinated as they become eligible. The vaccine is safe, it's effective, it's free, and it remains our best tool in the fight to end the pandemic. We urge everyone who's eligible to get vaccinated and to help us get to herd immunity. I'd like to turn it over to our epidemiologist, Dr. Kate Pack, now to discuss how effective the vaccine has actually been in Sonoma County in a segment of our community that has achieved herd immunity, and that is our elderly population who are in skilled nursing facilities and residential care facilities. I'll turn it over to you, Kate. Thank you.
Thank you, Dr. Shende. Okay. Yeah, so I wanted to share a story of how herd immunity is improving outcomes within one particularly vulnerable population in our community. Cumulatively, there have been over 1,100 COVID-19 cases among residents at senior residential care facilities and over 988 cases among staff at these facilities. And older and medically vulnerable residents have accounted for 53% of the deaths that have occurred in Sonoma County during the pandemic. Currently, 95% of residents and 85% of staff at these facilities are fully vaccinated. If you look at this chart, it shows cases among residents and staff at these facilities over the course of the pandemic. The darker blue indicate resident cases, the lighter blue indicates staff cases. This, whoops, I'm not sure why my screen went dark there. Okay, the dotted line here is about mid-February when most residents and staff at these facilities were fully vaccinated and the facilities began to reach herd immunity. We have seen a drastic drop in cases and resulting hospitalizations and deaths after vaccination. There have been no new resident cases since March 5th. That means today, it marks 2 months with 0 cases among residents at these facilities. Likewise, there have been no resident deaths since mid-February. So these are very promising results that we've seen in this population, and these results are beginning to be mirrored in our general population. We're seeing the same trends in terms of fewer cases among the more highly vaccinated age groups. Our cases are starting to shift towards those who are in their 20s and 30s, age groups in which there are fewer people who are fully vaccinated. And a primary goal of the vaccinations is decreasing the severity of COVID-19 and resulting hospitalizations and deaths. And we've seen a large decrease in case transmission as well as COVID-related hospitalizations and deaths. And these data suggest that vaccinations are really starting to work in our community. In order to decrease our case rate further, it's going to be important for the younger age groups to get vaccinated. And we also see in our case trends now that about a quarter of our cases are due to gatherings and travel. And so this really indicates that it's still essential for community members to take health precautions as restrictions are eased if we want to keep the case rates low. Okay, and I'll turn it back to Supervisor Hopkins.
Thank you so much, Kate, for that. It was a really, I think, hopeful look at the data of what it looks like when we really are able to achieve herd immunity in a particular population. I appreciate that. Now I would like to welcome Sheba Person-Whitley, the Executive Director of the Economic Development Board, to our conversation. Sheba, we've heard that businesses should prepare to return to normal capacity levels once the state moves beyond the blueprint. Could you tell me a little bit about what the new normal will look like for businesses once we fully reopen?
Absolutely. Thank you so much, Supervisor Hopkins. And that's a great question. I know that Supervisor Rabbitt quoted the quote from the governor. Really, they're still looking for what they are calling common sense measures for protection, including masking and vaccinations. And so in terms of the normal, unfortunately, that has been our normal for over a year. Masking, making sure that we are, safe in the way we do things. And so we can anticipate that even after we have moved past the blueprint, that we will still see masking as a requirement. At least in the interim, we continue to watch what comes out of the governor's office and out of CDPH to see if that guidance changes over time. But as of now, we can anticipate that we won't have those limitations on capacity, which is going to be phenomenal for our local business, many of whom have been completely shut down or operating at a very reduced capacity for over a year now. So that won't be a restriction, but we can anticipate most likely there will be continued restrictions and requirements around masking, and of course, any other mitigation measures that the government, the state might come out with. And I will say short term, what we're seeing is a lot of pent up demand. We've been hearing that for quite some time. People are itching to get out. They want to patronize their favorite local eatery or visit a winery, for example, go out to the coast or go out to Sonoma Valley and all these other wonderful places that we have here in the county. So there is a lot of demand. I can anticipate, and what we have seen, as soon as business can reopen, people will go out, they will shop local, they will want to travel. Of course, what we are working on is to make sure that the marketing that we are collaborating with others on is that they do so safely, and being a champion for small business and supporting small business. One of the potential challenges that we are starting to see is workforce. There were a tremendous amount of people who were either furloughed or laid off because of the shelter-in-place orders and restrictions related to COVID-19. Some of those individuals had to seek work in a different industry, for example. Some of them are still receiving those unemployment benefits, which of course have been expanded on the temporary basis. And so, we see potential workforce and filling some of the positions that are going to be required to be filled in order to have our local businesses open at full capacity. We're starting to see a little bit of a challenge around that. And so what we are doing is we're partnering with the Workforce Investment Board to try to find ways to fill those gaps, to make sure that anyone who is ready and able to work has an opportunity to do that, whether that be some things that we're hosting in terms of job fairs. We have a couple of live stream events that we're doing just this week, specifically for local employers, so that if they're trying to do reskilling or any sort of hiring, that they understand what sort of resources are available to help them. So I think that's what we can certainly anticipate that we're going to see over the next couple of months. And I'm happy to put that information in the chat. So if there's any local employers out here who are looking for workforce solutions, again, we do have a couple of webinars this week, and we would love people to tune in and hear about how we might be able to assist.
Thank you so much, Director Person-Whitley. It seems like we're starting to see that light at the end of the tunnel for small businesses, but I want to acknowledge that a lot of small businesses are still struggling to stay in business and are still concerned about folding at this moment in time. I know we've talked a little bit about some of the resources available for small businesses in the past. I'm wondering if you could talk a little bit about the money that is now available. I believe it's from the federal government to help Sonoma County restaurants, wineries, caterers, and other food businesses that have been hit hard by the coronavirus. I'm wondering, what kinds of costs are covered by this restaurant revitalization fund, and more importantly, how do folks try to get some of that money to help them out?
Oh, great question. So we have been waiting with bated breath, I think like everyone else, to see when this package is going to be made available. The priority application just opened May 3rd and will remain open through May 23rd. And it is exactly what you're describing. It is a specialized fund that is to help some of the most hardest hit. The restaurant and hospitality industry, if we're being really honest, has really been decimated because of shelter-in-place orders, which we know that we had them for a reason. It was really about keeping our community safe. However, the impacts have been devastating. We've seen, some businesses completely shut down, as well as others be restricted. And so restaurants can apply, food stands, food trucks, caterers, bars, lounges, taverns, snack bars, beverage bars, bakeries, pubs, wineries, small inns, if they offer beverage on site, and any other licensed beverage producers. And so in terms of what might qualify, whether it be, things such as your payroll expenses, including sick leave is also covered. Any sort of payment obligation that business owes to a mortgage or in terms of a lease for a rental space, any sort of debt that they might be incurring, principal and interest can also be covered, utility payments, maintenance expenses, construction of outdoor seating, because we've seen parklets and other types of really innovative, creative ways that businesses and particularly restaurants and others have tried to take advantage of outdoor seating in order to help build capacity. So that is covered as well. Certain types of supplier costs can be covered as general operating expenses. And so we're super excited. Again, it is unfortunate to still be in this situation, but it's also, if there's a silver lining, is that we finally have some relief that's available through the Small Business Administration. EDB is actually going to be hosting 2 webinars and workshops this Friday, particularly for any restaurant, again, brew pub, caterer, or any of the others that we mentioned who are interested in trying to access this funding. We will be doing this workshop in English and in Spanish this Friday. We encourage people to sign up. Our workshop is free, and we will have staff on hand to provide technical assistance, answer questions, and make sure that our local restaurants are able to take advantage of this source.
Thank you so much, Director Person-Whitley. We also have with us Peter Rumble, the CEO of the Santa Rosa Metro Chamber. I'm wondering, I know that you're on the front lines of hearing directly from businesses every single day, and I'm wondering how are local businesses feeling about reopening? I'm also wondering if you could cover a little bit of the regulations that still do apply to our small businesses. I think a lot of folks think, oh, small businesses only have to comply with the state public health order. But the reality is that there are also Cal OSHA standards that are in effect for the foreseeable future. So I'm wondering, number one, how's it going? Just sort of check in with our small business community. And then number two, if you could share a little bit of insight on the regulations that small businesses are currently under.
Absolutely. And thanks for having me. I really appreciate the opportunity to join and help share this perspective and information. I think what is coming through to me now is finally some hope for what's in front of us. Some, as has been mentioned already, a little bit of light at the end of the tunnel, so to speak, where in a recent survey that we did, we still had some anxiety about the ability to remain open, given the restrictions, even though there are less now than they have been. But the majority of businesses, to echo what Sheba mentioned, was some anxiety around the ability to staff up and to really open in a way that set them up for success. And so what most small businesses are looking for now are the ability to avoid some of these smaller costs that they haven't been able to generate enough revenue to pay. So talking about taxes and fees and other regulatory costs that they might have. And then getting to your next question, Supervisor Hopkins, is the ability to avoid additional requirements being laid on top of them, right? Because this is sort of I try to find the best analogy with my team, because as a chamber, we're an employer as well, subject to all these regulations. And we were talking through just this afternoon about the things that we have in place and the things that we need to do. And it really does start in some cases at the federal level, but Cal OSHA has very specific requirements that you need to have in place within your office setting or within your workplace that govern how people sort of behave in that work environment, how they can congregate, what they need to have in place, what you as an employer have to provide to your employees, both in terms of safety as well as supplies. And it's a fairly extensive list, so it's probably not terribly beneficial to run through it all here, but businesses should take a look at the state's website. And just like the Economic Development Board, the chamber puts on seminars as well for small businesses. And then you start to layer the additional regulations on top of something like Cal OSHA, where you have CDPH. Those guidelines have just been updated on the 3rd of this month. I would put a plug in as an incentive to go get vaccinated. The CDPH guidelines allow for individuals to do more in the community and with other members of the community should you receive your vaccination. And then we start to step down into our local health orders. All of these things are important to keep our community safe and to help show the way for our businesses to operate. And all of them are really particularly complex for mom and pop businesses that are trying to navigate their way through it all, both in terms of cost as well as understanding. So that is the landscape as we're seeing it now.
Thank you so much, Peter. I have a question for Supervisor Rabbitt, which is something that you have really on, and that is a waiver of environmental health fees. I'm wondering if you could provide an update on that from the county perspective, and also just share why this was an issue that you were so passionate about.
Well, I appreciate that. And I think the board has unanimously supported the concept of waiving fees and or reimbursing fees of, especially for entities that had to be closed for a certain period of time. Obviously, it's a business. It's to help out those businesses, business relief, but it really is only common sense. The truth is the county conducts an awful lot of inspections for food safety and all the right purposes, a lot of it on behalf of the state, really. But in this particular case, when these businesses were forced to be shuttered by those same state laws, we want to have that common sense approach and make sure that we can do what we can to help them out. We'll backfill it with COVID dollars. And I do appreciate your leadership on this and the rest of the board being unanimous and moving forward at that. Thank you.
Thank you so much, Supervisor Rabbitt. And now, Peter, I've got a personal question for you. I hope that's okay. My question is, are you getting vaccinated and why? And, a little preface is that I know that you, as well as Director Person-Whitley, have been on the front lines in terms of just receiving heartbreaking phone calls from small business owners, right, who have really suffered through the pandemic. So I'm guessing that you have sort of a personal as well as a professional stake in the answer to this question, but I'm hoping that you'll share a little bit about your choice and why you're making it.
Absolutely. Well, I'll start on the personal. Oh no, it's not going to show. Here's my card. You could see there. Oh, there, put it in front of my forehead there. Here's my card. I'm vaccinated. My wife is vaccinated. When Pfizer becomes eligible for 12-year-olds, my daughter will be vaccinated. On a personal level, listen, we were able to hug my my in-laws, the grandparents of my kids, for the first time in about 14 months, just the other weekend. We were able to see them inside, go visit their home for the first time in over a year. Our family holds giant season tickets, and I am going to play hooky with my son, and we're picking the game to go enjoy together, something that we haven't done in well over a year, actually. Just being able to be around my friends who are also vaccinated. All of this, of course, in compliance with guidelines, but just feeling like a human being again, frankly. That is my personal motivation on a personal level. On a professional level, listen, the faster that we can get to a level of vaccination that gives us that sort of magical herd immunity, the faster you're going to be able to sit down in your favorite restaurant and not have to worry about it. The faster you're going to be able to be in the park and not have to sort of awkwardly look at the person coming, along the trail and figure out if you're supposed to put your mask on or leave it off, or give stink eye to the person who's maybe like coughing or sneezing along the way. The faster that we're going to be able to go into a retail shop again and help them out, to go into the used bookstore and get something to read. Frankly, the faster that gyms are going to be able to allow me to go in and lose my COVID, I got to be honest, more than 20. So just getting back to whatever feels like normal. And it will not be the normal from 2019, but it will be back to something that we can live with and not have this profound sense of anxiety and fear about our future. That's why I got vaccinated, both for a self-interest as well as a community spirit. And I really encourage everybody else to find their reason, because I guarantee you have one.
Thank you so much, Peter. And I am super excited. I get my second vaccine on Saturday, and I can't wait. Feels like should throw a party, and just every little incremental step to normal, as you said. Speaking of herd immunity, I would love to ask a question of Dr. Mase, which is, we're not yet at that magical herd immunity, as Peter said, in our vaccination effort. And there are still variants that are circulating in our community. Do you think from a public health standpoint that we'll be ready to fully open by June 15th?
Well, we're not quite there, but the fact that we're getting into the yellow tier makes me very hopeful that our community transmission is very low. So there will be risk still, especially if you're not vaccinated. So really getting that message out that now, you can get an appointment, probably same day, very quickly. Please do go out and get vaccinated, because as we open up everything on June 15th, as scheduled, if things go as expected, then we will be at risk if we're not vaccinated. So even though we hadn't quite gotten to herd immunity, I think it's appropriate for us to move forward and really try to get to people who have any hesitancy and allay their fears and let them know that it's okay to go get a vaccine.
Thank you so much, Dr. Mase. Next question is for Ken, which is that, Ken, I think that we're starting to hit that inflection point where the vaccine supply is actually starting to outpace the demand. A few weeks ago, you could hardly get a vaccine appointment. I remember being so thrilled when I scored mine after the April 15th eligibility phase. But now it sounds like appointments are plentiful and that walk-ins are being accepted. We're even meeting people in their neighborhoods with a mobile vaccination clinic. What does this new phase look like for our vaccination effort, and how close are we to really getting those hard to reach residents? And then a follow-up for Dr. Shende, which is, as we're looking at this kind of supply and demand, you mentioned that pretty soon Pfizer, it looks like, is going to be approving, having the vaccine for those ages 12 to 15 approved by the FDA. And so I'm wondering how that's going to impact our vaccination campaign as well. And Ken, you're on mute. Must be something in the water today.
Thanks, Supervisor Hopkins. Appreciate that. It amazes me. We talk about how fast things have moved in this vaccine phase of the pandemic, and I looked back and realized that it's barely been 3 months since we even started the constellation of clinics. Most of the clinics are less than 3 months old, and we've already matured the model to where we were well over, had too much capacity, far too much capacity. Now we have capacity and vaccine, and we're not able to fill all the appointments, frankly. And we've gone to our partners, both our community partners, our stakeholders, and asked, what more do you see? What's the next phase? And we asked this a while back, and they said, get out into the community. And so that next phase is happening now. we are partnering with Curative, and you may recognize the name. They've been doing a lot of testing over the last year in our community. They also do vaccines. They run the vaccine, the drive-through vaccines at Tiburon Ferry, at Golden Gate Fields, at Dodger Stadium. They're coming here. They're going to do a mobile van with us and run that 5 days a week so that we can get to those communities that are priority communities that have historically been underserved, and where we really feel we can make an impact on finding individuals that that have not been vaccinated yet. So we're starting out on the 13th. They start their progression. They'll be working 5 days a week again, Thursday through Monday. So we're sure to hit weekends. We'll be that first week, we're at Our Lady of Guadalupe Church for 2 days, Thursday, Friday. On Saturday, Sunday, we're at Cottingtown Mall. And on Monday, I believe we're at St. Leo's Church in Sonoma Valley. And then we are working on finding new locations, mostly in the faith-based community, mostly churches, because people want to go to trusted locations and be with trusted individuals. And that van will serve these groups. Along with Curative doing that, we're supporting them by having both an operational liaison with them, embedded with them, an equity liaison embedded with them that will be just looking at equity issues and making sure that the client experience is really great for those communities that we're outreaching to. And then we'll also have a resource table there for people to get resources, not only about vaccines, but about other issues that will help them in the healthcare areas. So we're really excited about reaching out and going out to the community to find individuals and meet them where they are. In addition, at this time, again, we've talked a lot about our constellation of clinics and the FQHCs, the federally qualified health centers that operate these, and other partners, close partners. I can say that we've listened to the community, and all of them have moved to a model where they are accepting walk-ins at all those places. OptumServe in Rohnert Park, all of the federally qualified healthcare centers at whether it's Huerta Gym or at Guerneville School or at Sonoma Vets Hall, Petaluma JC, or Santa Rosa JC at Petaluma, all of them accepting walk-in clients. So we've also heard the community and toggling over to that model as well. And then lastly, we're supporting community-based organizations that are doing pop-up events. We just had a great event last Saturday where the indigenous communities had a big event at the fairgrounds, and we opened up the fairgrounds, and Sonoma County Medical Association did vaccines during the event, and it was a very, very successful event where the community and the government came together and really achieved some great results. So we're moving to these models where we're getting out to the community, where we're doing much more outreach, and we're looking for any way, because it's getting tougher, honestly, to find the individuals out there that want vaccines. So we're doing a lot more outreach.
So, and I'll add on to that. So yes, it's harder to find, but also I think it's hard for many people out there who are working 1 or 2 jobs, and they've got kids and there's school, and there's so much else going on in their lives that they may just not have had a chance to sign up, or they haven't had the time. So we are really trying to tailor some of these clinics to the weekends as well as evening hours. So, and just as we have now reached a certain point, now we're going to be adding the 12 to 15-year-olds, and that's going to add 37,000 more people who will be eligible to our ranks of who are eligible for the vaccine. So to that point, how are we going to reach these people? As I mentioned earlier, we will be having clinics in collaboration with SCO as well as with Safeway, and they'll be 2 times a week. And we are making sure that Pfizer is offered so that we will be able to give Pfizer as that age eligibility moves down to age 12. In addition, the clinics that Ken mentioned, the curative clinics, will also be using Pfizer, such that they will also be able to reach the 12 to 15 age group. So we're doing our best to try and reach as much of the population as possible in the places where they are at the times that they would like to. And again, the goal is to try and get our entire community to a level of immunity that we all will be able to benefit from, so that we'll all be healthy and be able to enjoy all the fun things that we used to be able to do. To add to what Peter was saying earlier, in addition to going to games and being around our friends and our family and loved ones, being able to travel once again, being able to not have the fear of bringing untold harm possibly to others. And simply be able to gather in our own homes. So these are things that we used to be able to do 14 months ago, and we can do them again. So again, we're trying to reach everybody where they are, and we encourage people. And if there are questions, then we would love to be able to answer them. So for the school age population, we will also be working with the schools to have webinars and to be able to answer parents' questions, because I'm sure there will be quite a few coming up. It looks like also the vaccines may be able to be given in pediatricians and family practice offices going forward. We will get more information on that in the next week or two. So that also provides yet another trusted messenger where people can go to make sure that they are comfortable with the vaccine and have another opportunity. So many things are changing over the next couple of weeks.
Thank you so much, Dr. Shende and Ken, for the update. I really appreciate that. Now I'm going to hand it over to Paul to take questions from members of the community and media.
Okay, thank you all. This has been a good discussion this evening. We do have a number of questions from our viewers. We do want to remind people following us on Facebook Live to go ahead and, if you have a question, to go ahead and post it in the comments area. The first question I'm going to direct to Dr. Mase, and perhaps Adam, our Deputy County Counsel, is available as well. This regards one of our viewers asked, would you talk about the recently changed mask guidelines from CDC and the California Department of Health? This individual notes that not enough people, she doesn't think enough people are aware of these new guidelines. Do you want to take that on, Dr. Mase or Adam?
Yeah, thank you so much, Paul. So I am going to turn over to Adam to go over the specifics of the changes, the recent changes. And it's a great question because I know that a lot of people are wanting to know have more clarity around it.
Yes, so the state just announced the new face covering order and had some changes for fully vaccinated individuals. So fully vaccinated individuals, those would be individuals that have received at least 2 shots for the 2-shot vaccines, Pfizer, Moderna, or the 1-shot Johnson & Johnson, and 2 weeks after that, they are considered fully vaccinated. Fully vaccinated individuals are not required to wear masks outdoors unless they are in what the state calls crowded outdoor events. Those include live performances, parades, fairs, festivals, sporting events, and other similar activities. Furthermore, fully vaccinated individuals can do not need to wear a face mask or physically distance when they are with other fully vaccinated individuals, both indoors and outdoors, or when they're with unvaccinated individuals from a single household, meaning that they all live together, the unvaccinated people, and who are also at a low risk of severe illness from COVID-19.
Great, thank you. Thank you, Dr. Mason. Thank you, Adam. This next question I'm going to direct toward Sheba and Peter. I think this is kind of an example of where we get mixed guidance coming from different entities. The question is, will there be guidance provided on vaccination as a mitigation measure in the workplace? For example, if employees are vaccinated, can they, with face coverings, be situated within 6 feet of one another? Now, Sheba and Peter, I believe that's really a Cal OSHA requirement, right? They're still requiring 6 feet, whereas CDC is saying 3 feet in some areas. Do you have thoughts on that?
I'll start off and then of course turn it over to Mr. Rumble as well. But that's a great question. I think it speaks to what Peter was talking about earlier in terms of the regulatory environment as well as conflicting information. And so what we have continued at our local level here within the county is that we are advising people to adhere to whatever guidance comes out of the state. That is the official guidance that we have been posting on our site. That is what we have, been having translated and sending out to our partners, whether they be chambers or trade associations and others, so that they can get the word out to their members. And so I agree, it is quite frustrating when you have conflicting information, especially when you might have something that's coming out of the CDC, but our state is doing something a little bit different. But what we have continued to do is adhere to whatever is in our local health order, as well as anything that comes out at the state level here within California.
Yeah, and I would just note, I mean, the language from the state is all employees shall be separated from other persons by at least 6 feet, except where an employer can demonstrate that 6 feet of separation is not possible, except for momentary exposure while persons are in movement. And then it goes on in greater detail. So, I mean, that's the standard, and that's what we have to account for. That will necessitate ongoing telework in some cases. There are exceptions where in an office environment, people have their own office and close their door. And so there's some allowances with that. And there's just a lot of nuances within that. I'd also note that May 20th, I think the date is, the state may update these orders as well. So it is an ever-shifting environment, in addition to the somewhat complex environment it is on any given day.
Paul, can I add to that?
Yes, please do.
I just got off the phone with the state like 50 minutes ago. So, and it appears that the state will be posting new regulations, including regulations that address that particular issue, possibly as soon as this Friday. And then the vote on adopting those regulations would be, could be as early as May 20th.
Excellent. Thank you all. That's really good, timely information. Our next question I'm going to direct to Dr. Shende. You had mentioned how the Pfizer is seeking emergency use authorization for the vaccine for those as young as 12 to 15-year-olds, which could come possibly by next week. Heather, one of our viewers, asked, how can we be sure the vaccines are safe in children as young as 12? You have thoughts on that?
Yeah, that's a great question. So whether it's safe in that age group is the same criteria is used as to find whether it was safe in adults. So studies have been done. We don't have all the data yet. That's why FDA needs to evaluate it before giving their approval. But once that data is evaluated and once it's made available to providers so that we can review it as well, then we can be assured that the same rigorous standards were used in approving the vaccine for adults and those over the age of 16. It's a really good question. The fact that they are looking at large groups for the adult population, they looked at 40,000 or more before they approved it. And I don't know exactly what the sample or the volume size is of these groups, but they are looking at something similar to that. So once you have that kind of data, then it's reassuring as to whether a vaccine is safe or not. And it's all the same rules that are used for any vaccine approval is what is going to be used for approval of this age group as well.
Great, thank you. Okay, at this point, we're going to go to some of our media partners. We're going to start with Phil Barber. Good afternoon, Phil.
Thanks a lot. It's been a while since we all got together. So, Dr. I'm sorry, Dr. Mase, you mentioned that Sonoma County is currently sort of right on the cusp of orange and yellow as with the adjusted daily case rate metric, particularly. As you look at cases over the most recent period that will be evaluated, what's the outlook that you see for the county going to yellow next week? And I guess I would throw in how we're testing too, because it might depend on how that rate is adjusted by the state.
Yeah, thanks, Phil, for that question. As I said, we're right on the cusp between orange and yellow, so it's a little hard to predict. We have been getting an adjustment factor under 1 the past couple of weeks. So I think it was 0.94 this last week, meaning that we're testing just above the state median. So the more we test, the better adjustment factor we get. And it's on the basis of the adjustment factor that we met the yellow this week, because our unadjusted case rate, I believe, was actually 2, adjusted was 1.9. So like I said, since we're right there on the cusp, it's kind of hard to know if we're just going to get over the finish line for yellow next week or not. I'm going to ask Kate to jump in and see if she wants to add anything to that.
Yeah, I think you pretty much covered it. You know, we have been staying right around 2 new cases per 100,000 per day for a little while now, and it, depending on that testing volume adjustment factor, it really makes a difference. So wherever the state is with their testing volume next week and where we are is really, I think, going to be a key factor. But yeah, it's really hard to call. But I would say we're staying around. I think today we're at 2.1 unadjusted and 2 adjusted. So if the tier assignment were made today, we wouldn't need it. But we're very close.
Thanks to both of you very much. I wanted to ask about any potential enforcement of COVID safety restrictions for businesses. I know that the county has attempted to have a light hand on that and not beat businesses down, but there have been fines, there have been some punishments. And I would assume that when businesses weren't supposed to be open at all, it's pretty easy to see if a barbershop is secretly cutting hair or something. But as if capacity goes from 25 to 50% or 50% to 75%, that gets maybe a little hard to determine. What will enforcement look like as we continue to progress through the tiers? And I don't know if that's more for the supervisors.
Supervisor Rabbitt, you want to jump in?
Sure. Well, I will say that I think enforcement will continue to be what it was, complaint driven. And I think that, we'll continue to make sure that we have an education first policy and any egregious actors or violations are properly dealt with. And I think that's been pretty consistent with the county. It's difficult when you have some people that are just, obstinate about moving forward and following those guidelines. And it's a challenge that it's not unique to this county. I think the entire country is experiencing this, and we'll continue to try to straddle that, make sure that we're effective and have that enforcement in place.
Great, thank you. I could have a couple other questions, but I know we're running out of time, so I'll let some other people ask theirs.
Yeah, Phil, Tennis Wick could probably help with that, the actual logistics of code enforcement at this point, but it is still, our complaint line is still operative. Let's go to Aiden Vaziri. Aiden?
Hello, how are you guys doing? I have 2 questions. One is specific and one is kind of broad. The first one is, has the state given you any specific guidance about what businesses can expect after the June 15th date? And in order to prepare? And then the second question is, Sonoma County was in the purple tier longer than most Bay Area counties, and you will be one of the first that moves into yellow if it happens. And how does that feel to get there so quickly? So you can take those in any order you'd like.
Well, I see Supervisor Rabbitt has unmuted. Maybe you want to.
I was only going to add that I think it's indicative of the good job that's been done in the county, that getting the testing out, getting the vaccines out from top to bottom. Ken, Dr. Mase, Dr. Shende, everyone has really been putting in the hours to make sure that the logistics are in place. Very appreciative. I think consistently we have gotten more shots in arms in comparable counties. And over the weeks, and it hasn't been all that long, as Ken said, but over those weeks and months, it really adds up. And so I think it's not surprising. It was frustrating to be stuck in purple. We were moving out of that in December when the state froze everything, or we were very close to getting there. We had concentrated on that testing. I think at the end of the day, if as time passes and we look back at where we've come, I think that we'll all agree that you know, while it was frustrating, we went through this in a way that was safe and didn't expose the county to any more harm than the pandemic did in general, and that we really did have that leadership there, and I'm very appreciative of that. So I just wanted to make sure I put that out there.
Yeah, and if I can just add, I mean, the vaccination effort, I think, and again, hats off to the vaccination team, Dr. Shende, Ken, and his whole team, because as you can have seen from data that's been presented, we're really kind of leading the pack along with a few other counties in getting a percentage of our community fully and partially vaccinated. And you just saw the data from Kate showing the impact of vaccination in one area where we've actually had a chance to look at it, which is a skilled nursing facility. So the more that people get vaccinated, the more immunity there is in the community, and the less likelihood of transmission of COVID. And therefore, we're in a better place moving towards the yellow. So I really do have to underline the vaccination effort that has led us to moving into the yellow, along with all the other things we've been doing all along for the past 14 months.
Ken, do you have that table that you could show how we compare to counties of our size? I don't know if you have it readily available. We can. You're on mute again.
It's like we haven't done this for a year. Here you go. Yeah. So yeah, we've to date administered in this county 472,000 doses. You know, in 2 weeks we will have hit the 500,000 dose mark, and that's when you think about the time, the 3 months that we've really been into this. It's really remarkable what our providers have done, and you can see we're doing very well. These are doses per 1,000 population, and we're comparing with the top counties here. These are all the mid-sized counties in California. The one thing I just want to continue to emphasize, though, is as we move into the yellow tier, and as we talk about how case rates are dropping and so on, I want to emphasize that nearly a third of the population that's eligible has not received their first dose, and it's crucially essential that people get into the clinics at this time. The appointments are available. You can go to so many different locations, and I urge people to do that now before the model changes and the clinic structure has to start closing down. So I don't want to scare anyone, but I also urge people to have a sense of urgency to continue to move us, because the yellow tier isn't enough, right? We want to go to the 0 tier, right? And that's what we want everybody to be healthy and vaccinated. So thank you.
And just to add to that, yes, there may be a change in the clinics and in availability of appointments at clinics, but healthcare providers, Sutter and Kaiser and Providence, they also do have vaccines that are available at their clinics. So Again, if you go to socoemergency.org/vaccines, there will be many, many options that are there.
Thank
Great.
you. And then did you have an answer for the, as far as the state guidelines for reopening after June 15th?
So this is Sheba here from the Economic Development Board. I can just tell you that we are watching closely to see how the guidance develops. As of right now, we can anticipate that businesses will be able to open for the most part without those capacity restrictions that they currently have. But at least in the short term, there will be masking requirements. We are waiting on additional guidance to see how that shapes out in the long term. I know everyone has talked about how we are really anticipating the further reopening and getting back to some sense of normalcy. We're all waiting with bated breath, as we said before, to get there. But we also know that there might be some additional guidance. I know that our partners in health have seen some drafts of some of that guidance, but still waiting to see what the final looks like.
Thank you.
Okay, and let's go to Susan Walbars. Susan?
Hi, thank you. I just wanted to know two things. One, is the Johnson & Johnson vaccine still being offered, and are people declining it in Sonoma County? That was question one. Question two is, are you having trouble getting vaccination numbers out of the Indian Health Services?
Well, I'll start off by, sorry. So I'll start off by answering the first question about the J&J vaccine. Yes, we do have it in Sonoma County. It has been offered. There are certainly some people who have some concern about it, but it has been available and is being administered throughout the county. I don't have the numbers, honestly, on how many people are requesting a different vaccine, but there certainly has been acceptance. And the second question, I'm sorry, could you repeat the second question?
Sure. Are you having trouble getting vaccination numbers from the Indian Health Services?
Oh, vaccine numbers. No, well, on our dashboard, we do have the percentage of the indigenous Native American population that has been immunized. We get all that information from CARE, from California Immunization Registry. And it's all reflected on our dashboard. I don't know if Kate, if you have anything to add to that, but their immunization rates are very good as well.
Yeah, I don't really have anything to add.
Thank you.
Okay, thank you all. We are past the top of the hour, but this was a really good discussion tonight. And I just want to thank you all. And I'm going to turn it back to Chair Hopkins.
Thank you so much, Paul. And I just want to say a special thank you to all of our panelists for joining us today, and also the crew who helps put all of this on, in addition to Paul's communications team, Jordy, our Spanish interpreter, and Odie, our ASL interpreter. For everyone else, I would encourage you to go to socoemergency.org/vaccine for more information about the vaccine rollout. And we also urge you to follow the County of Sonoma Facebook page, and you can follow us on Twitter. Hope you join us next Wednesday at 5 p.m. for another of these live community briefings. And as you can hear, my 2-year-old is telling me it's dinner time. So everyone go have some dinner, get your vaccine if you haven't already, and take care and have a good week.
So.